Now we take a look at how problems of a privatized medical system, such as the ones in the USA, are also emerging in Peru. Our correspondent in Lima now with more.
Oncosalud is a private health clinic that was found to have the highest number of fines for malpractice and has refused to pay all fines in full. That information was made public and it is available through an online app thanks to a small investigative journalist team called Ojo Público, or Public Eye.
32 clinics from the country were fined in the last 5 years for bad practices and services to users that caused damages in their health and have not paid their fines. These fines surpassed $3 million and were established by Indicopi, the organism who until recently was in charge of monitoring the clinics.
A new agency called Oncosalud has been created to do the work of Indicopi to make sure health clinics are providing the best practice. But it is headed by a former high-ranking officer of private clinics, and the fear is that she will side with the private sector instead of the patients. The NGO Justicia en Salud helps patients with their cases against private clinics, and they have documented many stories of abuses.
The clinic did not have that program. It did not vaccinate the child against tuberculosis, and the child, at 6 months old, had an episode of tuberculosis in the most aggravated form, the meningeal one. The parents obviously did not diagnose the tuberculosis that attacked the child on that time, and even the private sector did not identify it. And it's only another clinic that they are able to detect it and start the treatment for the child.
The growing private medical businesses have now over 9,000 clinics, and large multinational corporations are increasingly monopolizing these services. So far, the issues raised by Public Eye have been ignored by most of the private local mass media, which earn large advertising revenues from private clinics. Rael Mora, teleSUR, Peru.